Without any further ado, I'm privileged to introduce our second speaker, Dr. Deeksha Singh from Kanpur, India. She's certified and registered women's health physiotherapist and an invasive transvaginal and transrectal pelvic floor rehab specialist. Dr. Deeksha is the owner and founder of Hormonal Wings, Perfect 10 Maternity Rehab and Physiotherapy Clinic for Women Health and Counseling. She's also a licensed instructor in pelvic floor rehab, pre-postnatal fitness specialist, and is also certified in rehab of rheumatoid arthritis. Dr. Deeksha is also the author of the book entitled It's All About Pregnancy. Tonight, she will be enlightening us with menstrual awareness and pelvic floor exercises. Without any further ado, I now invite Dr. Deeksha to take the spotlight. Hello, Dr. Deeksha.
Hello, Habiba.
It's a pleasure having you here.
Yeah, same here. And thanks for inviting me.
No problem. Please carry on.
So, before starting anything, I just like to introduce about the basic about the pelvic floor muscle. We read about PFM. Pelvic floor muscle is there, a hidden muscle. So, it's like you can see, it's a human skeleton structure. You can see pelvis at the central of the body. In upper part and lower part, pelvis is at the central of the body. It's a pelvic bone. As you can see, there's like a two sits bone is there. You can see, and in front is a pelvic, and in the back is a coccyx. So it's like this structure. More brief, it's like two sits bone is there. In front is pelvic. At the back it's coccyx and sacrum. So it's like we are like in this structure. So the cavity here is, you can see in this skeleton structure, there's a cavity. This cavity is basically filled by your pelvic floor muscle. So it is basically doing, it's like just stabilizing supporting your pelvic organs, which is inside like your uterus, bladder, and rectum. So they're like in anterior part, you are having your bladder. In mid part, you are having your uterus. In the posterior part, you are having your rectum. And in the it's like a cradle, and you are having your organs over there. It's like you used to support, used to continent. Because of this muscle, we don't leak. We are like it help in continent, in voiding too. When we are urinating, when we are defecating, it's like it helping us while relaxing. So it's like help also in, it's having vagina too. So it's help in your childbirth. The major portion in any woman life is a childbirth. From that time to from your menses, your menarche to your childbirth to your menopause, this basic muscles play a major role. So we can say it's a multitasker. And it's about, when we talk about breathing, whenever, just like I breathe in and breathe out, I breathe in through my nose and breathe out simply. You all can feel it's like the muscle. When you think about that muscle, this muscle, just think about it and just breathe in and breathe out. What you will feel, this muscle is sometimes lifting and relaxing if you're doing breathing in a proper manner. So it's helping in breathing part also. And somewhere it's in the central part of the body. So it's like it's help you in stabilization, like help you in spine control too. So it's like the basic muscle function is like your support, stabilization, your continence, like work as an sphincter. And this basic muscle is working the fast twitch fiber and slow twitch fiber. Two muscle fiber is there. Just like first fiber is basically 80% is used to help you in making continent while you are working or coughing. And the second part is help you in relaxing while you are defecating and voiding. So this is about your pelvic floor muscle. Now I just want to talk more about what are the dysfunctions you got. Dysfunctions like these are the functions. I just tell you, it's like support, stabilization, breathing, childbirth, voiding, defecation. If some dysfunctions are like there, dysfunctions like this is the muscle, you can see. This basic is the pole is the muscle. This is like a fist and in a diamond shape. So this muscle is basically divided into three parts: in a superficial, middle, and in a deep part. In deep part, it is having your endopelvic fascia is there, your nerve and artery and vein is there. And in the front part, you can see This is like your ischio-cavernous muscle. This is vulvospongeus, superficial transverse perineal. This is in middle. This is your perineal body, and in when it comes to middle part, they are having a coccygeus, levatorani, and external urethral sphincter and compression muscle. So basically, this is your muscle. If it don't work properly, or dysfunctions occur when it is too loose or too tight, or there is any neuropathic disorder are there, it's too loose, then the organs it's like holding will definitely fall out, so prolapse is there and incontinence will be there, that is stress incontinence. And if the muscle is too tight, that means we find some difficulty with voiding and defecating, that means constipation is there, and some like hernia, that hernia condition may be there, and piles may be there. So means we don't need to strength in muscle and to relax type, we need a normal muscle tone. When if we want to work on a proper functioning of lifestyle, we want to work with proper body, that means we need normal muscle tone, not too tight, not too loose. So this is the basic muscle of pelvic floor muscle. And why it is important when we talk about menstruation, because it is holding the main organ uterus, and this is the wall endometrium, and this is your fallopian tube. So basically this is your ovary, this is holding and supporting that like cradle your uterus, that your main part for your menstrual cycle. As Dr. Nida just told, a menstrual cycle is basically divided into two phases. You know, the first phase is basically about your menstruation, and second phase about your ovulation. Yeah, it's correct. But I would like to add some more. Like it's not divided into two parts, divided into four parts. And we don't call it menstrual cycle. We call it female reproductive cycle. Why? In the first phase, we start with your menstruation till 6 days or 5 days, whatever days you are bleeding. Then comes the day of your follicular phase, when your ovarian cycle will begin and follicular stimulating hormone will rise, and your ovaries will start producing more mature follicle to produce ova on day of ovulation, that is your 14th day. And this comes the day 14th day, your ovulation day is there, that is the third part. On that day you will release one ova, and what is like some hormones too, like estrogen and progesterone, because menstruation is a phase your body is getting ready for the pregnancy. If you're not get pregnant, that these the thick wall of endometrium will fall off, shed off through your vagina, and the ova will disappear from your fallopian tube, and you know the ova will be there in fallopian tube for 24 hours. So it's like if you don't get pregnant, if you are not under any conceive, then the cycle will like luteal phase will begin. Your corpus luteum is there, and corpus luteum, what you see ki corpus luteum will release estrogen and progesterone hormone. So due to release of that hormone, they will rise again in the luteal phase, that is your final phase. And there is like again the uterine thickening, that is endometrium wall thickening is again going on. Due to this thickening, and there is like no pregnancy is there, they will fall off again for the next cycle. And this is like how your cycle every month begin. This is like predicting like 28-day cycle is there. Some in some women this is 35, in some women this is 32-day cycle. So you can just predict your cycle via many app, many ovulating app is there. You can just get your ovulation day, and just try to maintain your proper data when it comes to ovulation, your menstruation, and your all luteal phase. So when the normal menstruation begin, you know, at the time of menstruation, your all hormones are at low, and your wall is already shedding off. That means your somewhere your pelvic floor muscle is too weak at that time. And at the follicular phase to your ovulation phase, your pelvic floor muscle is at normal tone. And when it comes to luteal phase, due to estrogen excess and due to relaxin hormone, there's laxity of your connective tissue and ligaments. So that means due to this laxity, your pelvic floor muscle have to work, means overuse of muscle is there. That means the pelvic floor muscle is at their strongest. So in the first phase of cycle, it is at like weak. In second and third, it is normal. And in the final stage, luteal phase, it is at their strong. So this is how we decide any exercise plan for the women. So this is the basic introduction about the pelvic floor and your menstrual cycle. Okay, Habiba, I just spoke.
Thank you so much, Dr. Deeksha, for briefing us and for those amazing demonstrations. Now I'll be moving forward toward the question and answer session. So my first question to you is that why did you become a physiotherapist? And with all of the workload, what does your typical day look like?
Okay, why do I become a physiotherapist? So basically, when I was in my 12th, I just visited a clinic and I was too excited. How come a doctor treat a patient without any medicine and without any prescription letter? So I was too excited. I just want to know what is the therapy he's doing, what is he telling to her patient. So I was like too excited. I just want to join it and I just want to explore more. Or and then my father just that gave me that protocol. You can just go like this and you can just join the college. Then you can just go give the national exam is there. So it was like the excitement is there. So I just join it when it my exam is completed.
Wow, that's interesting. So how do you stay informed about the upcoming developments in your field?
Okay, thanks to you people. First, the webinars are there. Thanks to this COVID era, we have got some time for the study part too. And in the second part, we got some research data, like review studies are there. And even I'm an author and I'm a blogger too. So I used to write. So I'm just incorporated with the study all time. And thanks to my patient.
Okay. All right. So what do you like the most about this field, and what do you dislike the most about this field?
Okay, the best thing, no one will die. Less morbidity level. There's a less chances of a patient will die. So if you're having any attachment, any things are like emotional attachment is there, you can just maintain it. So unlike other fields, less number of patients who die in our field. So this is the thing I like most, and number of therapies are there for the same basic disease. So I like it most. You can use according to your strength, according to your knowledge. And
Yeah,
I
that's an
never
interesting
dislike the
answer.
field, so I don't know how to dislike it.
Wow, that's really an interesting answer. Moving towards my fourth question, that we can see that the COVID-19 virus is affecting the cycles of many menstruators who have suffered from it. So, what is the reason behind it? Would the rehabilitation exercise help improve their health post-COVID?
Okay, so basically, when we talk about COVID, now COVID is something we have in memories like isolation, like quarantine is there. We all are in our home. We are with our home and work and our child. So it's like now more pressure is on the woman part because she have to
Yeah.
work in the kitchen. She have to look after her job and she have to look after the child too. And her if she's having any old parents, then she have to look after on them. In this environment, she will got full of stress, so that stress will lead to the synthesis of hormone cortisol. That is your flight and fight hormone, your adrenal hormone. And what it will cause, it will just create more pressure and just disturb your hormone level, and just the FRC, your female reproductive cycle, will drop down. Means you will have more blood clot while you are menstruating. You will have irregular periods. You will have more painful periods. So, because the researches are less, I can't say clearly on databases, but I can say one thing: ki it's not only in post-COVID patient, it is seen who are not infected too. It's like a majority of women goes through this pain, like of clots, irregular periods are there, and even if they are, I can say if your menstruation miss for 1 to 2 months, it's like temporary stress disorder. But if it is like more than 5 months, you're not menstruating, then just consult your doctor, or you can just take an online consultation with your gynec, or your pelvic floor rehab therapist can guide you too. And beside what exercise you can take, exercise like I just want to recommend ki, just go for fixed routine. If you are like you are living in a home, you don't go anywhere, just start your day with normal don't start your day with caffeine. Start with some physical activity. If you're like having your job in your morning duration, then go for evening physical activity. Because whenever you are doing physical activity, exercise, whatever exercise it is, either it is breathing, aerobic, high intensity exercise, endorphin hormone is there, that is feel good hormone. That means if your feel good hormone is there, that means your cortisol level will down, your stress will be reduced. If your less stress is there, that means your cycle, your lifestyle will be on routine.
How does caffeine make a difference in your health?
Yeah, caffeine is like a in basically in our country, in India, I can say, like caffeine, we don't take only caffeine, we just take the white sugar, that is carbs, okay, with it.
Yeah.
We are not taking the black part. We are making it like a poison. We are just taking it daily, and we are not taking a one cup. And you don't have to start your day with caffeine. Just start your day with, I can recommend with flaxseed, so that you can have omega-3 in the morning and magnesium content. Because in this COVID phase, magnesium content, vitamin D, and the calcium content of the women is reduced to half, because they don't opt for proper diet. They don't go for any physical activity. Obesity increases, and stress is more, and like number of pregnancies are more there in
Yeah.
this COVID era. So this is like there are likely changes are there. So don't
All
take
right.
stress.
All right. All right. So, what exactly is pelvic floor rehabilitation? Like, if you could elaborate in simple words, we can easily learn about more exercises.
Okay, a pelvic floor rehabilitation is something treating your pelvic floor muscle and getting it into a normal lifestyle in a normal way. So if you're like urinating, you can't just hold your urine. You can't just you are leaking. Your organ is coming out from your muscle. That means somewhere you are having dysfunctions. And if we are treating that dysfunction with the help of exercise, some modalities are there, and even some mobilization technique are there. So this is rehabilitation process. Rehabilitation is not a simple word; it's a technique. It's like it's having many ways.
Okay, so how important are pelvic floor exercises in the postpartum period? Can you share ways of being regular at it in order for it to be really effective?
Yeah, as I just saw your this model, you can see when you are pregnant now, you like this is like working like a cradle, and your baby is going inside the uterus. So when from the first trimester, when your baby is like growing, so it's like pushing your all anterior and posterior organs, and like creating more trauma and too much pressure on your pelvic floor muscle. That means you are already through too much load on your pelvic floor muscle during your antenatal time, from your during your pregnancy. Then comes the time of labor, when you just increase the load of pressure is just 50 times more, which you are using in your pregnancy. So that means your muscle, which is already weak, you are just pushing it more to so that your baby will come out easily. And it's like dilation is there, and during delivery, either whatever delivery process, like cesarean section you're taking, forceps delivery or natural delivery, whatever delivery you are taking now, you are just like pushing it, and there's like postural instability is also there. You are just pushing it, the baby, through here, through vagina. So the baby is coming by crushing your muscle, by tearing your muscle. That means when you are come to postpartum, your muscle, your vaginal muscle is already laxity. Its laxity is there. That means in near future you can call your organs may fall off due to laxity, because it's the muscle is not able to hold that organ. And also there is like a tear is also there, which will cause pelvic pain in near future. So to overcome these pelvic floor dysfunction in near future, I would recommend that just please join for postpartum rehab, or for postpartum your fitness session, or also go for antenatal part.
All right. So basically, the cause of painful periods is still unknown, even after going through various examinations and tests. What do you think is the reason for extremely painful periods? What can we do to reduce the pain?
Basically, when it comes to your period, your painful periods, it means like something you are like hormonal disbalance is there. As I already told, cortisol level is there. Means you can be dehydrating. Dehydration is the reason, because your muscle is too tight at that time due to dryness. And then comes that part, your thyroid dysfunctions can be there. Your prostaglandin level is increases, and sometimes your low hemoglobin is there. Means you're anemic sometime. And calcium and magnesium level is also down, and vitamin D deficiency is there. then and lifestyle, your lifestyle is not up to date. Yeah, like you are like not sleeping at all. That means somewhere you are opting for you are just inviting that painful period.
All right. So, can PMS affect normal life function, especially when it comes to a change in mood swings?
Yeah, definitely, because PMS is something now, because some women get PMS that symptom 10 days prior, some get 2 days prior, some get 3 days prior. But symptoms are like depression, anger, and you know why they come. This is also because of hormone changes, because a halfway ovulation is there, and it will lead to your less low level of estrogen and progesterone, due to which there is low level of serotonin, which is your mood swing hormone. Because serotonin is used to maintain your mood and your sleep. If the level of serotonin will drop, so somewhere your mood will under swings, and you are like insomniac too. You are not getting proper sleep, and you are like getting anger, depression, anxiety. For example, you just woke up with very good mood, but now suddenly you got so anger, you want to destroy everything. So definitely it will destroy your lifestyle.
So, should one be concerned about conceiving early by 28 to 29 years if they have PCOS?
Yeah, if we are telling about PCOS, that mean ki review studies and data. So ki no, it is not like recommended ki 20. If you're 28, 29, you have to conceive, because later on you can't. No, you can conceive up to 35. 28 to 35 is a clear data in the review study and research data too. But you need lifestyle modification, and sometimes you need proper guidance regarding your physical activity, your exercise. But the basic part, what is the main thing? A woman is born with all eggs. She don't have to get new eggs. When she is already born, she is born with egg. She is having 480 periods throughout her life. Till the age of 50, she is having 480 periods when she is having normal periods. And 3 to 5 drops of spoon of blood she discharge when she is menstruating. That means you are already born with the egg, but only you are ovulating monthly. So that means if you're not going under ovulation in PCOS, reason can be any, as we have already discussed, hormonal, lifestyle, because PCOS is something which is lifestyle disorder. It's not a disease, it's a full of symptom. And every PCOS woman is having different symptom. Might be some is having obesity, some is become too thin. So this is the reason we can't just describe PCOS in a one term. So, but you can conceive at the age of 35, and till 35, you don't need any fertility treatment. But it will depend, as I say, it will depend on your symptom. What symptoms you are getting. If it is different, then first we start with lifestyle modification.
Okay. So, the next question is that, like all girls, they suffer from pain, mood swings, depression, and anger pre-menstruation. Can you please tell us ways to manage these obstacles?
As I already told, PMS is something related with low serotonin level. That means your mood and sleep is affected due to low level. And as it is high, then your mood will be okay, your sleep will be okay. If it is like low, that means your mood and sleep will be affected. So what do you have to do? You have need some feel good hormone, that is endorphin. And endorphin will come from physical activity. You have to work from your stress reduction, your physical activity like aerobic, high intensity training. Your normal walking is even good. Your cycling, swimming, whatever will rose up your endorphin level is good for your PMS.
So, it is regarded by some of the fitness trainers to skip workout during your periods. So, is it safe to perform heavy exercises during menses?
uh, Actually, you can do exercise. You don't have to skip exercises. As I already told you in before starting key, it's like at the very in menstruation, your pelvic floor muscle is weak, because your that hormone already fall off, and there is like a falling of your endometrium wall. You can go for exercise, but try to avoid all these exercise in which your intra-abdominal pressure is more. Like crunches, you have to avoid the crunches. You have to avoid the V shape. Like in Hindi, we call it that no, Naukasan or Nauka pose, your boat pose. So that means whatever exercise, na, just increasing your intra-abdominal pressure. You have to avoid those exercise. You can go for high intensity exercise, but I would recommend during menstruation you are already exhausted, because you are somewhere
Yes.
your body is falling off now. So I would recommend just stop it for 6 days. Go for normal exercise like walking, stretches is there. Go for Kegels if you want for pelvic health areas, as your pelvic floor muscle is too weak now. Just go for strengthening. Why you want to waste your time in high intensity exercise?
All right. So, urinary incontinence is the common problem almost every woman suffers. Can you guide these exercises, and is there any contraindication to this?
Okay, yeah. Okay, when it comes to the incontinence, it is common, but it is not normal. Means you are
Okay.
leaking. It mean you are leaking. It's not good. But before prescribing any exercise, you have to know the cause. Why she is leaking? Either she is having too tight muscle, too loose muscle, or combined. Basically, what type of incontinence she is having? Like she is leaking throughout because of stress, or she is having urgency, but her bladder is all time full when she is using the washroom. And the third is she is having mix. She is having urgency too, and she is leaking too. That means we have to know the cause first. We have to know the cause by asking the lady, or we can use the finger method. We can just ask for the self exam of the women. We just ask her to just use her finger, if she can just put her fingers in her vagina, if she can just hold it, two finger, three finger, or no finger at all. That means we can know the strength of the your pelvic floor muscle and the activity of your pelvic floor muscle through self exam. If like she's not able to, then you can just help her. But for this you need some in not in India, but in outer countries, you need a license for it. You can't just go for you want, and you just check for your transvaginal. So you need a license for it. And if she's like incontinence, like leaking, it's like there are like three condition I told. In this, the two condition is like hypertonus means tight muscle, and hypotonus means too loose muscle. In hypertonus, she is having urgency whenever she is using the washroom, but she is not like a feeling of fullness is there. And in case of leaking, in case of loose muscles, that means she is leaking somewhere. 2 to 3 drops of leakage is there. So I will recommend that first start with a bladder and bowel diary. Just maintain a diary. Start with the fluid you intake, your timetable, when you woke up, when you take breakfast, when you do exercise, when you whatever your lifestyle, just you put in that column. In second column, what the fluid you intake, like number of glasses of water, caffeine, whatever you take, now just in this column. And in the third column, just the output, number of time you use the washroom. And then the third output, when you go for the exercise. And the exercise is basically go for the Kegels. If you're having loose muscle, that means you have to go for more contraction and hold. Means Kegels, you have to just hold that muscle, and you just try to increase that number. But you don't have to hold the urine. While you are urinating, you don't have to hold the urine, because it will just disturb your muscle function. And in the second part, when you're having too tight muscle, just try to relax more. That means your muscle is too tight, so you have to, what you have to do, just try to contract, then relax, and try to maintain this relax part. So you in first part you are trying to maintain contraction. In second part you are trying to maintain your relaxation, so that your that tight muscle will become normal, and your that loose muscles will also become normal through contraction. So, and also you can use the neck technique. Neck technique is basically just like you are having cough, sneeze, and something like your cold is there. So just you, whenever you just like to sneeze now, just try to hold, contract your muscle while sneezing or coughing. This is the neck technique, and Kegels is the best part.
All right, all right. So, what is the role of pelvic floor exercises in post-menopause in an elderly woman?
Okay, menopause, post-menopause is a time when you are already 4 to 5 years, you are not menstruating, and your estrogen level, your hormone level already dropped off. Means your estrogen is just in minus, only 20% you are having menstruation, then when you are menstruating. So that means your estrogen is dropped. That means somewhere your vaginal lining, it will become thin. And there is decreased libido, that means reduced sex drive. Whenever you just try to have sex, that means you are having painful sex. And dryness of vagina is there, and you are more you can listen to elderly women, she is like complaining of constipation. She like she can't relax her muscle by defecating. So more strain on pelvic floor muscle is there while she is on postmenopausal. So this is all because of hormonal disbalance of estrogen drop. So what we have to work, on our pelvic floor muscles. Like we have to just learn her Kegels, normal Kegels with plyometric exercises, with normal movement, walking, even cycling too. She can go for Kegels while she is
All
on
right.
postmenopause.
Okay. So apart from menstruation, what is the basic protocol of exercises in obstetrics and gynecology disease?
Okay, if I'm talking about ops and gynec in a woman's health, so in ops and gynec is a connection which is having common link, that is pelvic floor muscle. We can't ignore pelvic floor muscle. Either you are birthing your child, either you are having cyst, either you are having whatever, you are having cancer, you are having tumor in your cells. That means the common part is your pelvic floor muscle, that cradle part. So that means we have to just the protocol we use is basically the counseling of patient. Secondary, the proper assessment is there. We just find out about the muscle part. And third is basically we just learn our patient, try to make them learn about the muscle identification, so that they know what is pelvic floor muscle, and they should not use accessory muscle like their butt muscle, their abs like transverse abdominis muscle, and their multifidus muscle. They don't have to tight their abdomen, they don't have to tight their adductor, their thigh muscles. They just independently has to use that pelvic floor muscle. And beside muscle identification, there is another thing, that is muscle awareness. How we make them aware about the muscle, just by let them touch, by hearing we just to call them, just squeeze that muscle, lift it, hold, then relax, squeeze, lift, hold, and relax. So this is a command we used to give to our patient. Then third command is the part is muscle activation. As muscle is already identified, you already aware about the muscle, now you have to activate that muscle by doing kegels or pelvic floor exercises or doing core breath. So throughout this, now we opt for functional training. The exercise we taught them, we now on their activity of daily living, their daily lifestyle, whether they are going for office, whether they are birthing their child, they just use this exercise. So this is the basic protocol we use in ops and gynae.
All right. So I'll come towards my last question to you.
Yeah.
And that is that what is your driving force towards this field? What actually keeps you motivated?
Okay. I can say my patient satisfaction and confidence, and and faith on me, and my parents' satisfaction when they saw me working now. So I'm just like, I'm satisfied with my work, and I'm just, as I already told you, I just love my work. I love my field.
That's
And
lovely.
and beside it, I don't know anything, so I have to work for it.
That's absolutely lovely. Thank you so much, Dr. Disha, for such an informative and insightful session. I would like to ask my audiences, we've almost covered all of our agendas, I believe, but if you guys have any other questions, please pop them in the chat box. I will be reading out to Dr. Disha. So if any one of you have any questions, please pop them in the chat box. Do we have questions? I'm just waiting for people, if they have any inquiries, they can like pop in the description box.
It was really very great, very much helpful session.
Yeah, exactly.
One more thing, I just forgot one thing. Actually, my first book is on, it's all about pregnancy. It's on pregnancy part. And my second book will be soon, and it will be on periods. It's all about periods, and it will be launching soon. So the book will cover about your basic period problem, period disorder, its basic treatment plan you can have at your home, and it's for all women. And the best part, the price of the book is under 100 only. It's for every girl, so every girl can afford it. It's for the awareness part. It's not for any I always want to write a book for women's health. So this is my gift to every girl. They can use it. We'll
Okay,
launch soon.
that is so lovely. If all of you are listening, I'm sure, so please get your hands on this book. It will be launching soon. So I have plenty of questions here. My first question is that how do you opt for pelvic health career in physiotherapy?
Good
Okay.
question.
Okay, when I was in my third year, I just listened. I was in library. I just listened about the OB-GYN, and I just asked my professor, what is about the OB-GYN and the relation with physiotherapy? He said, it's not for you if people. It's like it's not going to work in India. So I was like, how come something is there and it is not going to work in some country, because we are having humans, we are having girls there. So it's like when I was in my internship duration, I just searched for it. I just got from then I got from my mentor Kim Bopney. She's like in Canada. So I just contact her. I just give my all exam. I just gone there and just studied. And whatever I studied, and then I'm having a habit of writing. So it's like from that time, from it took me 7 years to write a book, my first book, and it's like from that day my passion didn't die.
All right. So Ikra Amir is asking that how long does it take to strengthen pelvic floor?
It will depend upon how much the degree is there, how much your muscle is loose. It will depend definitely on the degree level of your weakness.
Okay. Himanshi Chandak is asking that can you please share some of the exercise for pain relief that might help during menstrual cycle? I think
Okay.
she just addressed it, but still you can like answer it again if you want to.
If you are just asking for pain during menstruation, you can just simply, you don't have to opt for any exercise. Simply just go for the castor oil pack. You can just go for the abdominal massage. It's like think like this is your abdomen and this is your umbilicus. You have to just lift your muscle like this. Okay, like in kneading, you have to just go for the kneading around your muscle and try to relax your muscle doing your kegels along with it. You can just do with your own hand only, and you can also use hot water bag and just go with the relaxation exercise along with strengthening of your pelvic floor muscle. Means your body is relaxing, but your muscles should be contracted, and you have to hold it, then relax it. And it is, I think this will work. You don't have to take any medicine.
All right. So Mehek Oberoi is saying that it was a wonderful session. Could you please tell the PT management in case of ovarian cyst?
Ovarian cyst. Yeah, definitely. It is like, now the same. Cyst is basically like, as I already told you now, if you're having cyst, that means you need somewhere lifestyle modification because stress is there and serotonin level is already dropped. So, that ovulation is not going every month. That means you have to work for lifestyle. Lifestyle is not a single word. When we talk about lifestyle, that means we have to work on address our stress. And how we address our stress, you just simply can go for visual imagery guided technique. For this technique, what you have to do, just lie down in your room, just play a well-to-do music, whatever music you like, and just think about the place, just like whatever the place you want to visit, in whatever country you want to visit, just think about that country, imagine about it, and just try to abdominal breathing, breathe in, breathe out whenever you are doing the abdominal breathing. And there's a one correction I would love to add here. The breathing people do is absolutely wrong in most of time, because there are like four kind of breathing is there. First is clavicle breathing. When you saw a person, they're like shoulder is going up and down. This is wrong breathing pattern. Second is like your thorax breathing, like your chest is coming up and down. This is also wrong. And third is your abdominal breathing, means your abdomen is going in and out only, but you're not using the other muscles. So basically, your core muscle is maintained of front transverse abdominis, in back your multifidus, in front your diaphragm, and in low back you are having in inferior part your pelvic floor muscle. That means what you have to do, you just have to breathe in through your nose, and when you are breathing in, you just feel the pelvic floor muscle is going down, and when you're breathing out and your abdomen is coming in and your lung is like expanding when you're breathing in, and when you're breathing out, you can just check it out with the help of pulse lip, like you're blowing your candle while you're in your birthday. It's like pulse lip. So what you feel, your abdomen is coming in, that means your transverse abdominis is activating, and somewhere your diaphragm is like contract, it's like relaxing, and your pelvic floor muscle, it's like eccentric, it's like coming up. So it's like a proper breathing pattern. If you're using the proper breathing pattern, the chances of getting postural dysfunctions, your OB-GYN dysfunctions is less.
All right. Now I would take only a last question. It is that, do you think that a previous surgery would affect the reproductive health if the levator ani muscles are compromised?
It will depend on level of injury you have gone through.
Okay.
It will depend upon the trauma. If the trauma is for some minute, some second, hour, or for a month, so it will definitely depend on the duration. If the duration is less, the the healing chances is more, rehab chances is more.
All right. I'm sorry we're running out of time, so we cannot take more questions. Dr. Deeksha, some people are asking if they can have your contact info if they want to contact you. Can you please tell how can they do it?
Okay, you can just find me on my website www.hormonalwings.com. That's I'm founder of, and you can just find me there on my website.
All right, perfect. Thank you so much, Dr. Deeksha, for such an informative and insightful session and interesting demonstration. It was really enlightening. I hope we've covered almost all of our topics. If you guys have any further questions, you know where to contact her on www.hormonalwings.com. So now I will be moving towards the conclusion. As Michelle Obama said, and I quote, communities and countries and ultimately the world are only as strong as the health of their women. It is with great pleasure that I now present the word of thanks for this webinar's proceedings. Firstly, I'd like to thank our featured speakers, Dr. Deeksha Singh and Dr. Nida Rizvi, who despite their busy schedules graced us this evening with an incredibly enlightening seminar where we were extremely grateful to learn about menstrual health and pelvic floor rehab. I would also like to extend heartfelt gratitude to the Life Study Group's lead and core facilitator, Samantha Simbu, and by extension, all the leads for their major contribution in making this event possible. Last but not the least, ladies and gentlemen, I would like to thank all of you for accompanying us tonight and making our event a success, and we look forward to your continued support. Finally, for those of you who are interested in joining SAC and by extension the Life Study Group or Women's Health Team, please indicate by doing so in the respective section in the feedback form. Please note that certificates will be sent out within 2 weeks after the event. Thank you so much, everyone. Good night. Have a nice day.